Now, in the wake of the two attacks here in downtown Vancouver that left one victim dead and the other severely injured, supporting people experiencing mental health challenges while keeping the public safe is top of mind for many. Riverview Hospital was once BC's only mental health institution, housing thousands of people by the 1950s. In the 1980s, though, the province planned to close it and integrate people back into communities. In 1981, CBC spoke with one patient diagnosed with manic depression. He spoke about life after Riverview and the challenge of living in housing that was problematic for his mental well-being.
Bad days for me amount to depression. Like I'm either really high energy or I'm flatted right out. How the building I live in can contribute to a mood like that when I'm feeling down anyhow is that most of the fellows that live there a lot of them are alcoholic. Many of them have various kinds of physical problems that they've had. They're often on their last legs. There are various ex-patients living there. You get some really bad behaviors happening. You get people defecating in the hallway from time to time. There are cockroaches. There are mice. There are those things. The management really tries to deal with that and does deal with it pretty well compared to many other places, but none of that contributes to your sense of well-being. There was an old man a couple of months ago, stabbed himself twice in the stomach. He was a 68-year-old man with a little Pomeranian dog and a little TV. And one day he just had it. He tried to stab himself a couple times. He couldn't. He went down and talked to the manager about it after he stabbed himself and said, "I'm really sorry, I didn't make a mess."
Is so-called normal society a little bit afraid still of ex-mental patients?
I think they're a lot afraid, and I think it's unfortunate, like the recent murders in the Lower Mainland. Those kinds of things stick in people's minds. And as soon as they hear mental patient, they think of those.
Joining us for more now is Marina Morrow, the chair of the School of Health Policy and Management at York University. Professor, you've lived in BC, you've studied mental health supports here extensively. Now, while there are mental health facilities still operating in Riverview grounds, it's still a recurring discussion about reopening more of the hospital to help more people. What do you think of that call?
Well, first, I just want to say, that the horrible attacks that have just occurred in Vancouver, of course, have shaken people. And I think everybody shares a concern around it. And very much we want to have people to feel safe in our neighborhoods and communities. However, I think there's a number of myths kind of circulating around Riverview. And the first is that there's kind of this notion that once Riverview closed, we no longer had secure psychiatric beds. But in fact, in the province of BC, the number of secure psychiatric beds have actually increased. And the number of involuntary committals in mental health hospitals has increased quite exponentially, actually, over time. So there's this kind of idea that with the loss of Riverview, we no longer have secure psychiatric beds, but in fact, we do. What we have lost, though, is long-term institutionalization. And there's a reason for that. And the reason is that all of the available research, both in Canada and also internationally, shows that institutionalization is really a failed social policy. What it does is it removes people from their families, from their communities. It fosters a kind of dependence rather than autonomy. These are all things that we know really help people with their wellness. Mm-hmm. So it's well documented and well known, and internationally, we've really moved away from the model of institutionalization. So the idea that somehow, bringing Riverview back in its former form, that it would somehow solve, the complex problems we're seeing today, I think is kind of a naive notion.
Mm-hmm. Now, from a health policy perspective, what are the challenges, though, in treating people with mental challenges and keeping the general public safe? And we don't want to make an automatic conflation or connection between the two, but those are some of the concerns that are playing out here especially.
Yeah, and again, I think it's really important to note that statistically speaking, it's actually very rare for people with mental health and substance use issues to commit violence. They're actually more likely to be victims of violence. So I think that's a really important point. At the same time, I think we all struggle to think about how can we best care and support people. And what you need two things. You need social policies that recognize that mental health is in a context, it's in a broader context. You need housing, affordable housing, you need a secure income, you need social supports. You need a very robust community mental health system. So what we've seen is this kind of vicious cycle, that started way back in the 70s when we first started deinstitutionalizing people, where money was never put back into community supports. Mm-hmm. And so what happens then is people don't have the supports that they need. their first point of care is often through, a call from, from emergency, an ambulance arriving, the police arriving, people ending up in hospital, and then the cycle kind of continues. So you really need those robust systems of care in place.
Marina Morrow, chair of the School of Public Health Policy and Management at York University. Professor, we appreciate your time and your expertise. Thanks for joining us.
Thank you so much.